I appreciate it. Thank you all for coming today. My name is Paweł Wolczak, and I'm leading Accenture's behavioral health practice. Really excited for this panel. It's been months in the making to get these incredible folks here today. The topic that we're going to talk about is how governments, VCs, startups, nonprofit organizations can come together to innovate in 988 space and the crisis continuum space. Before I introduce the rest of the panel, I want to take a quick poll. So why don't you folks go to Slido? There's a QR code right there. I think you can connect to it. And we want to take a quick poll of how many people have actually heard of 988. Also, we have a bet going on. We have a bet going on who's buying drinks tonight.
You all better be on the right side.
I think I might have won. Well,
no.
Take your. All right. Well, so now, as the results come in, I'll introduce the panel. On today, we have Grant Reevy with Vibrant Emotional Health, the CTO, who is responsible for the rollout of 988. We have Isabel Rosenthal with Nima Health, Vivian Ho with Pear Capital. We have Vic Lenio with Flare Capital, and we have Caroline Fenkel with Charlie Health. So incredible group. The results are not coming in, so let's do just the old-fashioned. I don't see anything come through.
Oh.
Let's do old-fashioned way. Raise your hands. Okay, let's do.
Have you heard of 988? As you can tell, there are two people in this bet.
Okay, well, maybe
Keep
I
your
lost
hands up.
Maybe I lost the bet then.
I think you did.
I think I may have. So we're very excited. But so in that case, we'll be able to jump straight on to sort of the discussion about the innovation. I'll ask Grant. I'll turn to you first to kind of talk about just a little bit, so we level set, so we all have the same understanding of 988. Why don't you tell us about your work and what 988 is about in the future?
Thank you, Pavel. So it says beyond 10 million calls here. We actually passed the 10 million mark under 988 around July, and that was celebrated by Secretary Becerra. We passed the 10 million answered in August of this year. That was celebrated by Vice President Harris. We're probably just north of 13 million routed and 11.75 million answered at this point since July 15th, 2022. 988 is that evolution in the National Suicide Prevention Lifeline. It handles all sorts of crises, does not need to be suicidal ideation or imminent risk. It can be everything in that ecosystem. It is an entry point for care. Roughly 85% of our contact volume is about preceding situations that lead towards suicidal ideation. So financial distress, housing distress, domestic abuse, employment distress, all of that is an entry point at 988. The lifeline, as we talk about the infrastructure itself, 988, that launch in July of 2022, represents the introduction of text along with voice. We had web chat probably 3 years prior, back to pre-pandemic. Time passes strange around the pandemic, so I'm not quite sure when it launched anymore. And since the launch of 988, we've expanded that, in particular with dedicated services, the LGBTQIA subnetwork, in partnership with the Trevor Project. We have launched Spanish chat and text in addition to our Spanish voice service. We've expanded the Veterans Crisis Line access point, which is the Press 1 option with 988. And last September, or this September, we introduced geo-routing to the United States. And geo-routing is a huge evolution because there isn't access to geolocation information outside of the 911 ecosystem. So bringing it into 988, not at the precise level, but at the general level, so that we know approximately what county a help seeker in, is a massive evolution. That launch was followed by the FCC's notice of rulemaking, making that a mandate for 988 voice calls, and left the door open for us to also make that a mandate for text geolocation when that becomes available. All of this, as we have grown year over year, the year preceding our 988 launch was 3.4 million interactions. In this last rolling 12-month period, we're about 7.6 million interactions. So that is a dramatic growth. We're about 11,000 interactions a day. If you do the math, that's about 1 every 5 seconds. That's a lot of interactions.
Wow. Is election anxiety one of the reasons for call?
The election here will, no matter how things go today, we'll see a bump in demand to the Lifeline. It's probably going to be about a 30% increase over normal, and that'll probably last about 3 to 5 days if the 2020 and 2016 elections are any indicator.
Wow. So I think that, raises the question, there's clearly a demand, 10 million calls, there's clearly a demand. And I think the question that, I would love to hear an answer to is really from, someone like Isabel and Caroline, who are offering services for people in distress. Do you see yourself helping callers, 988 callers? So I'll turn to Isabel first.
Sure, thank you. I'm definitely like a 988 fangirl. I think it's amazing and has made such a big difference in care to have like actually a memorizable number that you can give to patients instead of like 1-800 plus like a million other numbers. But I think the reality is, people go to 988 when they don't know where to go for care. And unfortunately, in our current healthcare system, a lot of people don't know where to turn for behavioral health care. So I think 988 actually is this amazing psychoeducational opportunity to really teach patients about different disorders in mental health. Because the reality is mental health, like physical health, are different disorders and we treat them differently. So at NEMA, we treat post-traumatic stress disorder. And I think when I think about sort of how we can work with 988, I think about the fact that a lot of times people call 988 and they're maybe reporting symptoms that sound like depression or sound like anxiety. But then you find out actually that they've been exposed to a clinical trauma, and you provide psychoeducation about what PTSD is, and then someone says, oh, well, that actually sounds like what I've been experiencing, and then you can actually send them to like specialty behavioral health care from 988. So I think 988 is like so incredible. It's incredible that over 10 million people have used it. And I think there's really such an amazing use of psychoeducation about like, there isn't just general behavioral health, there also are like specialty care that actually can help you for your condition. And so that's what I'm thinking about, but yeah.
Yeah, so clearly yes. Caroline, I mean, I think same question for you. How do you see potentially helping people from 988? Do you see your organization doing that as well?
Yeah, at Charlie Health, our mission is to connect the world to life-saving mental health treatment, and we use that word life-saving really specifically because the individuals that we treat at Charlie Health are those that are in crisis, full stop. Our vision is to end world suicide. Big vision, obviously ambitious one, but those are usually the people that are calling 988, are those people that are thinking about suicide. So for us at Charlie Health, we talk a lot about how can we create a frictionless experience. So similar to how it is that you would get cancer treatment, where you go and see an oncologist and they quickly get you into chemotherapy and you have a caseworker that's talking to you. Why is that not happening in mental health treatment? Why do I have to sit and navigate and call 5 different numbers and figure out where the mobile crisis is and figure out which emergency room actually has a psychiatric unit? These are all things that nobody should have to worry about when they're in crisis. So when we think about when they call Charlie Health, we talk a lot about how can this be as frictionless as possible? How can we ensure that their hand is getting held throughout that time? And the truth of the matter is that when kids are in crisis, they're gonna call one of 4 places. If it's during the day, they're gonna call their insurance company, or they might call their primary care doctor. If it's after hours, they might go to the emergency room, they might call mobile crisis, and they might go to 988. And so our goal at Charlie Health is to be connected to every single individual where a person in crisis might need something and ensure that they know that Charlie Health is there.
Yeah, wow. Well, so clearly now we've got demand on one side, we've got supply on the other of those services. I guess now, how do we connect the two, right? And I think, Vic, it would be interesting to hear from you, any lessons learned from other startups in similar space, perhaps 911, that you've seen working.
Yeah, so we were talking about this a little bit earlier, but there is, I think, like a tendency to think about 988 and solutions around 988 kind of like solutions that are built around 911. The workflows are different. But a lot of the kind of unique challenges that some of the entrepreneurs and companies that have built 911 related businesses are really around like kind of the risk of triaging incoming calls and where to send patients, and then also having to navigate and contract with every local government, every EMS kind of agency, and make sure that they have all the right guardrails in place so that they can escalate patients, like if they've down triage someone inappropriately. So it's a different kind of situation here, and I think what Vibrant and Grant's team is doing is really creates an opportunity for some centralization of the tech stack in a way that doesn't exist in the same way for 911 related companies. And so, I'm hopeful that that's something that will allow other entrepreneurs in tech platforms to kind of plug into a shared system that makes it a little bit easier to get into one ecosystem and not like having to separately contract and negotiate networks with every single local government agency.
That makes sense. At the same time, do you see startups going directly to states or communities as well? Or do you think ideal lesson is, Vibrant can play a critical role in centralization?
Well, yeah, I think that so when you're triaging patients to different solutions, there's going to be virtual solutions that can handle patients kind of wherever they are across borders. But at some point, you do have to also interface with local resources. And so that's where building out all those solutions in the 911 space is a little bit complicated because they're different in every community. And maybe there's an opportunity for kind of virtual engagement in the behavioral health world that is more challenging for emergency medicine.
No, that's super helpful, super insightful. Vivian, I think it would be interesting to also hear from you. You've invested in a number of startups in behavioral health, or your company has. Any insights that you can share with entrepreneurs and everybody in the audience?
So I think we have a really exciting group here. I think we have, the technologists behind 988. And also solutions that are very innovative where we can triage care. I think sometimes when I think about sort of just like where can technology play a role in sort of making these systems be even more efficient, and what are the interesting trends that are happening. Since we're pre-seed investors, we really see companies from the ground up, and living in San Francisco, I think you can't really blink without seeing the word AI. So I think what I wanted to bring to this discussion was how AI can really make care more efficient, especially when you think about sort of the modality. So I was looking up at 988, and I could see like 25% right now are text and chat, and then 75% are calls. And I'm sure like on the other side, there are a lot of volunteers and humans on the other side, right? And I think that's really great. But I think there's also kind of this, if you think about it, kind of just like without sort of thinking about like AI replacing humans, I think you can think that humans naturally, some people are better at navigating these conversations than others. Some humans only speak 2 languages, and some people, I think you launch a Spanish line. I think, if we think about how AI can really drive more types of care. So for example, speaking different languages, you can automatically have access to 30 different languages. And I think, especially in times of crisis, especially in communities where maybe English isn't their first language, that can make a big difference in having someone really understand the nuances of your language. I can, speak for myself. My parents are from Taiwan, and when they go to the doctor, it's like they're like, oh, I have a stomach problem. I'm like, what was your disease? And they're like, oh, I don't know. I know it in Chinese, but like I don't know in English. And I'm like, how do I help you if I can't look it up? So I think sort of the language barrier is really exciting with AI. In terms of humans as volunteers, like kind of training them with simulations with agents, for example, right? Like, can you simulate this conversation with the agent before you talk to a real human who's at crisis? And I think, we can really upskill our workers with AI. And then I think at a certain point, we can really use AI to kind of, I think this is what Crisis Text Line is doing with 988 today, is like, how do we use AI to look at the severity of mental health, or the severity of the person across the line. So like, if they need help, they need more help, and they are waiting on the line, like maybe there's a way to triage them better so that we pay attention to the person who, isn't more in danger than the other. So I think there's a lot of interesting ways technology can make care more efficient. And then one last thing I would say is, I was looking at the stats, and like over 80% of the people who call 988 are under the age of 34. And I think it was like a really significant number, like 40% under age of, I don't know, like 14 or something, like super crazy. And, I know Charlie Health focuses on the youth, which is such a big crisis in general in the US. So I think, how do you kind of speak to them in the modality that they're most comfortable with? And, I think, I'm not Gen Z, but I think that a lot of them like texting, right? And so like, how do you kind of leverage texting as a modality and like use LLMs as an interesting way to interact with patients? So I think there's just like a lot of interesting things you can do with AI today.
Yeah, so I think all the aspiring entrepreneurs take a note. I think what's interesting about this is, yes, AI seems like a promise, but I think, do we see challenges? And maybe I'd be curious to hear from Grant about this. Grant, what's the thinking from Vibrant's perspective right now?
Well, Vibrant plays sort of a unique role in our position as 988 administrator. So we're, in some sense, operating on behalf of the federal government to shape some of these things, and we inherit some of their sense of risk. So if we talk about AI applications that interact directly with a help seeker, the promise is there, the risk is extraordinarily high. Because if there is an interaction that results in self-harm, the perspective from the federal government is going to be no AI at all in this ecosystem. And so my point of view, we have to be extremely mindful. There are a whole set of things that I would love to achieve before we put AI in front of help seekers or even crisis counselors in the system. And most of the people who take 988 interactions are certified clinicians. They are certified crisis counselors. There are some volunteers in the network, but that's really a relatively small number of individuals. So these are people who are trained clinicians here. But I don't actually want to give a trained clinician a phrase that they might say to a help seeker, and that help seeker represents a different culture or a different language or a different understanding, and that may trigger a help seeker to feel a different way. And we worry about that risk because of the level of stress and fatigue our crisis counselors face. So, more optimistically, where can we think about AI applications? One of those is looking at traffic through the network. So, Vibrant in no way takes all of the calls to 988. There are 216 centers here. I have at least one representative in front of me that takes those calls. But how do we manage that traffic through the 988 ecosystem? Unlike 911, which is regional, municipally oriented, here 988 is national. There's load balancing that we can do, particularly when demand shifts after a major natural disaster, like the hurricanes we experienced this year. There's another way where we can look at this where we know demand will increase because of the public discourse. So suicidal ideation has a proportional increase with the public conversation. If there is a public death by suicide, someone famous, Stephen Boss, DJ Twitch from The Ellen Show, died by suicide in December 2022. That was a 20% increase in volume. Kate Spade and Anthony Bourdain both died by suicide in the same week. A couple of years before that, that quadrupled the volume to the Lifeline. Robin Williams died by suicide a couple of years before that. That was a 10x volume increase. But we can see those conversations emerging in the public sphere with topic modeling, and then we can pre-position resources to handle that call volume. So those are some of the ways in which we can use it. The last thing I would say, knowing that I've gone on here, Vibrant is the administrator on behalf of SAMHSA, Substance Abuse and Mental Health Services Administration. We have a role in setting standards, but we do not have a mandate. We don't dictate what occurs. So the innovation and experimentation really resides at the state level and to some extent at the center level. And so that's where I would see innovation taking place is states like Georgia, like Michigan, like Arizona, like Washington, investing in other types of services and ways to bring technology to bear.
Yeah, so that goes sort of back to your comment around, centralization versus decentralization. Be curious to hear more from, Charlie and from NEMA Health in terms of your current customer acquisition, and do you see, how do you see 988 potentially channeling, right? And sort of in that context of, centralized versus local. It sounds like, just to kind of, make sure that I understand, Grant, what you've said effectively right now, this decentralized model seems to be more plausible. That's how I understood.
Well, the 988 model, unlike the 911 model, is looking to get that help seeker support in the community where the help seeker is.
Right.
And so that's the decentralization of it. We'll take the interaction at the national level, make sure someone can answer that call agnostic to capacity in the particular state or geography. And then once it's in that geographic area, make sure that they're connected to all the local services, which is where we need NEMA and Charlie to help us.
Yeah, so let's actually, Isabel, how do you see that working for NEMA? What is at the local level that you think you can do to help those callers?
Yeah, I mean, I think it's really interesting the point that you made that different centers are actually different, right? And how they handle 988 calls and also the resources that they offer. And the reality is different states have different resources when it comes to mental health. And what's incredible now about these virtual models, like Charlie, like NEMA, is that, we can provide consistent care across different states. But I think when it comes to forming relationships, the reality is we have to, each state is different, right? So we have to think about forming relationships at the state level to understand how we can help take referrals from that local agency.
Great. Same question here for you, Caroline. How do you, in terms of your customer acquisition and specific the callers from 988, how's that fit into your current strategy?
Yeah, so at Charlie Health, we're live in 37 states. So what we have is a group of individuals, some of whom are sitting right here, who go into their local communities and talk to places that are searching for resources. And oftentimes these are social workers that are in hospitals, sitting in emergency rooms. Oftentimes these are primary care doctors who need those resources immediately. So they go in and they're sort of boots on the ground, to be able to create and form those connections. So that way there's a really clear, warm handoff from the individual who is seeking help. I like that, help seekers. I've never heard that. That's nice. Help seekers, and being able to get them connected to Charlie Health. As far as where does 988 fit in on that, we have contacts at 988 to be able to take any patient who, is in a state that we're live in, and we're in network with every major payer. We're in with Medicaid everywhere that we can be, to be able to take any of those patients, especially because at Charlie Health we have a commitment to not have a wait list, so they can get in with a licensed therapist within 24 hours.
Yeah, thank you. I'm going to sort of go back to this centralization question because, I think that we need to sort of set up standards, it sounds like. Have you seen this actually work out anywhere, or, that you can maybe guide us or advice on that?
So I think, and maybe this is going back a little bit to the AI question, and we were talking about this at breakfast, and we were just kind of getting ready for the panel, but it's hard not to think about the story from earlier this year about the 14-year-old boy who took his life after developing a relationship with an online bot, and then that bot did not recognize and properly escalate that there was self-harm there. And this is not a healthcare company. Like, this was just like a modern consumer technology tool. I think all of the entrepreneurs that I've ever met in the behavioral health world building CBT companies have proper escalation procedures if self-harm becomes evident in even an automated conversation. And we've talked about how some of the foundation models, like the GPTs of the world, do have safeguards. But a lot of entrepreneurs are also building their own models, and not all of them apparently are very good at recognizing some of these issues. And so from a standardization perspective, it feels pretty obvious to me anyway that everyone in this room, I think this is very obvious to other tech entrepreneurs that are not in healthcare. They need to have the same escalation procedures built into other non-healthcare bots and tools and agents that kids are talking to and other people are talking to, or else we'll just continue to have kind of horrible stories like that. And so I don't know if that's exactly like the standardization question you were getting at, but I feel like there is an opportunity with a centralized platform to, whether it's just kind of like best practices, like if you're a consumer tech entrepreneur, you want to build an AI agent that chats with people. If they say something about harming themselves, point them to these resources. Or maybe even better, if there is an API set of tools that can be plugged into other systems. But if it is baked into foundation models, hopefully that kind of permeates through. But it seems like in this case that wasn't what happened.
Yeah, clearly, and it's such a tragic story. Grant, this is probably last point before we go to questions. How do you see those standards being? Do you see Vibrant setting those standards? Do those standards come from SAMHSA? Who would be playing that role?
If Vibrant sets them alone, we'll definitely get them wrong. So it needs to be collaborative. We have a role in partnership with SAMHSA, and so Vibrant, as the 988 administrator, we actually have a cooperative agreement with SAMHSA. It's not a hierarchical grant relationship, grantor-grantee relationship. It's a cooperative agreement. So we're more equals, and to that extent, we are involved together on identifying some of those standards. What I would say is SAMHSA is a very small federal agency. There's 35 or 40 people in the behavioral health space that support 988. And so the bulk of the work that is done to define standards is done in the network itself, the states, the centers, and Vibrant as administrator. So we're gonna have a role there for sure. We are one voice, but there are many voices that need to be included. one of our obligations as the administrator back to SAMHSA is to help coach them and guide them on things that might be appropriate as a standard. It's also SAMHSA's obligation back to Vibrant to say, look, as the federal government, we cannot dictate to states in these ways, and states have to have their own autonomy. So how does that work with centralized infrastructure? It gets complicated real fast. But the answer to your question is it's got to be many voices. Vibrant may be, in our role as administrator, the one that carries forward the torch, but everybody's got to come to the table with their ideas and pile on.
I just wanted to add that I'm not suggesting that we should have an AI agent talk to someone on the other line. I think there's interesting concepts in healthcare that I think could be applied in mental health. For example, we backed a company called Counsel Health, and it's run by a clinician, the CMO of Notable Health. He's a Stanford clinician for 10 years, and he is very familiar with how to apply AI in safe ways to healthcare. And what they're doing is they're having the ability to text the clinician across the asynchronously, and they have AI kind of empower the clinician to kind of do all the back office work and also draft the first message. And the clinician is going to approve that message, but you're not like just talking to a ChatGPT and like asking, like that's not sort of there's guardrails that need to be created and UI, UX and all that stuff for the provider. But I think what's really exciting about that concept that can be applied in this mental health framework is how do we like create, we're gonna have a shortage of clinicians, and so how do we get access to patients faster? And the only way to do that is if we can use technology to make, the provider more, happy or efficient, or, how do we basically 5x their ability to see more patients, but not like burn them out? And I think that's what's really exciting about AI today. I think there's a future world where there's going to be AI governance from either government or some coalition. There's already coalitions that are out there like CHAI that are trying to create guardrails around healthcare and AI because it's a very touchy subject. But I think we're going to get to a point where the government's going to figure out hopefully, or the government or coalition or corporations are going to or maybe nonprofits are going to figure out what are the guardrails. But for now, I think there's a lot of exciting ways to solve this problem with the tools, the frameworks that we have today.
Absolutely. And on that note, let's turn to questions from the audience. Actually, one of them is related to what you were just saying. With staffing shortages across the behavioral health system, how are peers integrated into crisis continuum? Who wants to take that? Brent, sounds like that might be your question.
So the question is about how peers are integrated.
Yeah.
The short answer is that's predominantly happening at the local level. There is some peer support at the state level. There are not federal programs under 988, let me be specific, for peer support, but that is something that SAMHSA is interested in and we're actively exploring, hopefully, in this federal fiscal year.
Okay, thank you. One more question. Does group therapy effectively deliver IOP, or is this primarily a cost-saving measure for startups struggling with profitability? I think that may be a question for either Nima or Charlie. Do you both want
I'll take it. No, there are decades and decades of research and literature that show us that group therapy is very effective, and there are some meta-analyses that show us that it could be more effective for certain patients than individual therapy. And that's pretty simply based on the idea that we are wired for connection. We're all born with an umbilical cord. And that this is in our bones, it's in our DNA, it's in our structure to be connected to others. And when we hear the words "me too," I've been there, I know what that's like, from other individuals, maybe not necessarily from a therapist, but instead from a peer, it can be incredibly healing. So no, not for profit and not to be more efficient, but instead this is about our patients and making sure that they get better over time.
Yeah, that's great. Isabel, do you want to add?
Yeah, I mean, I completely agree with everything Caroline said. The literature supports that group's work, and I think, to her point, like there is something sort of intangible about being in a room with people virtually or in person who have gone through your same experience, and also like learning skills together. Like when we think about DBT skills, which we offer, and like having accountability with other people is also such an important part of group therapy. So yes, not about cost savings, but about clinical effectiveness.
Okay, awesome. Thank you. Another question from the audience. How does Vibrant help call centers identify resources that are available in the community?
Boy, that's a good question. So all centers that are part of the 988 network have access to Network Resource Center, which is our essential tool. The NRC, as we call it, really needs to be maintained within the state, so the centers have an obligation as they use the tool to add to the tool. It is an extraordinarily difficult task to keep up with what are the current resources in the community. So this would be an interesting place for us to apply LLM or similar model to generate that renewable resource of what is currently available in the community. But the core answer to the question is the NRC, which is funded by SAMHSA, is available to all centers in the network.
Thanks, Grant. Another question from the audience is, what would investors want to see in a startup working in this space? Let's turn to Vic and Vivian.
In the 988 space specifically, I'm trying to think that's a tougher one. I think we talked about safety a little bit. I think that's maybe table stakes, but I think being able to somehow either be a referral destination or a referral source to the 988 platform, and just understanding how to include that in your ecosystem is critically important. And that's maybe not necessarily like what is going to make a company a billion-dollar company versus a smaller company, but I feel like those are things that in this space, is a responsibility of all of us. In terms of, some of the other kind of things that we'd look for as investors, I think goes back to any other type of company that we would look at, and maybe not necessarily specifically with 988 businesses, but similar to the companies that have been funded in the 911 space, like you just have to know your ecosystem and how to add value where you can, how to be an off-ramp to the centralized system here that exists, and how to responsibly send patients to it when you can't handle the situation or the patient that needs that help.
Yeah, and make best friends with Grant.
Yes, make best friends with Grant.
Vivian, what about thoughts from you?
Yeah, I think I agree with. I think Vibrant's an amazing solution. So I think they're serving their purpose. So the question is like, where is sort of the how do we like connect these resources? Maybe in a you think about Unite Us, they connect like a lot of Medicaid resources and benefits. Like, is there a way to coordinate? Like, is there a second step where you can coordinate care, in an efficient way with technology? We have a company in Medicaid that is doing that for Medicaid benefits, and I think you can easily kind of slot in. Like, I think we, as VCs, we want to. It's almost the answer to your question is like we want to see something. We want to fund companies that can be $3 billion to $10 billion outcomes, or maybe bigger if possible, right? In healthcare, it's a little bit hard to see right now. But I think like we want to see big ideas, and so I think you can start out as a wedge in this space, and then how does it apply to like other parts of healthcare? Because I think the way that the healthcare system is built today, it's like I'm going to go to my specialist and talk about cardiology, and I'm going to go to my endocrinologist to talk about my diabetes. And I think like we should have a more centralized way of coordinating care across someone who may have multiple, disorders or, diseases. So I think there's like, that's like kind of where I kind of want to see the vision of a company is like how big that market can be. And they can start out in a small, more narrow space, but like how does that apply to the rest of the healthcare system? And how do we eventually like reduce cost of care and prevent sort of downstream spend.
Super. Thank you so much for that. Super insightful comments and discussion from everybody. Thank you, panel, for this discussion. We're coming up on time. Let's give a round of applause for the panel.